my name is Sarah Beth, and this is What I Wish I Knew About Christian Sexuality, Episode 6, The Responsibilities of Sex. So you're probably wondering, why are you talking about this? I feel like that could be asked of any video that I've made thus far. And to help explain this better...
You freaking freaks! What will you learn? What will you learn? That your actions have consequences!
So, in this video, I'm splitting it up into 3 sections. We're going to be talking about STIs and STDs, and then we're going to be talking about contraception, and then we're going to be talking about pregnancy. So these are all the responsibilities that you have when you engage in sexual activity. And I think it's important because oftentimes the church will tend to just ignore these things altogether in their pursuit to just ignore that sex exists altogether until you're married. And then teenagers have sex or young adults have sex before they're married. And then they get in trouble because they didn't know what was coming for them when they did these things. Or they didn't realize the impact of the decision that they made and the responsibilities that they had in said activity. Yeah. So we're gonna start with STIs and STDs. STI stands for sexually transmitted infection, and then STD is sexually transmitted disease. And why do we need to prevent this? I mean, just in general, outside of the Christian community, more than 1 million STIs are acquired daily, worldwide, the majority of which are asymptomatic. Unfortunately, the lack of public awareness makes this worse, and most people don't even get tested to know that they have it, and then it can spread even farther. So we're gonna break it down to the top 8 STDs and STIs. All of these can be spread orally, anally, or vaginally, or prenatally. So if you have an STI or an STD and you give birth, you can even spread it to your child. An STD is a disease, so it's curable. So the first 4 are all STDs that are curable. So a list of STDs are syphilis, gonorrhea, chlamydia, and trichomoniasis. Most of these do not have any visible or physical symptoms, but all of them can really affect you long term. In fact, all of these, if left untreated, could be life-changing or fatal. As for the STIs, STIs are incurable, meaning that you got it for life. And these include, but are not limited to, Hep B, herpes simplex virus, or herpes for short, HIV, and HPV, or human papillomavirus. I don't know if I pronounced that right at all. With these, I'm going to be a little bit more specific in what type of experiences you'll have with each infection. For Hep B, it is a liver infection that can be transmitted through bodily fluid. There is a vaccine available, but for some, it can be short-term, and for others, it can be a long-term infection. Herpes simplex virus, or herpes for short, is treatable but not curable. There are 2 kinds, one that's spread orally and one that's spread genitally, and most people have mild to no symptoms, and others have very painful blisters, fever, body aches, and swollen lymph nodes. It lives in your nerve cells, and it can alternate between being active or inactive, and it can be triggered by illness, sun exposure, periods, injuries, stress, or surgery. HIV is probably the most famous STI. Once you get it, you have it for life, but treatment is available. The only way to know that you have it is to get tested, although some can have flu-like symptoms. There are 3 stages: acute, chronic, and AIDS, which can be fatal. Human papillomavirus, or HPV, is the primary cause of cervical and anal cancer, and it's the most common STI. Vaccines are available, and in most cases it goes away without health problems. If it doesn't go away, it can cause genital warts or cancer. So how do you prevent infection? You use contraceptives. Not all contraceptives will prevent an STI or STD, but some can. So let's learn about them. But this isn't just about contraceptives to prevent STDs or STIs. Contraceptives can also prevent pregnancy, which we'll go over in just a moment. So there's different contraception for men and women. So men, the most known, if you don't know about it, you should not even be thinking about sex, is a condom. A condom is 87% effective, and you basically use it every time, and the price range is from $0 to $2. Latex is the most common, but also synthetic condoms are available if you're allergic to latex. It can prevent against pregnancy, HIV, and other STDs. It's important that you don't use oil-based lubricants with a condom because it can rip or tear and make it ineffective. Now, this one is oddly, from what I've heard, Christian men's favorite contraception, and that's withdrawal. It's 78% effective. You use it every time, and it's free, so I guess that's the nice thing. But it only works if you do it right every single time, and it's more effective if you use it with another type of contraception. Basically, it's when you pull out before ejaculation, and you have to avoid getting it on your partner's genitals, or they could still get pregnant. And then there's vasectomy. This one's another common one, especially with married couples. It's 99% effective. It lasts for life, and it can range from $0 to $1,000 depending on your insurance. It's an outpatient procedure. Basically, they cut the tubes that produce sperm that we went over a couple videos ago, and your sperm count must reach 0 before having unprotected sex in order for it to be effective.
Snip, snap, snip, snap, snip, snap.
So for women, there's just like so much like contraception out there. For some reason, it's always our responsibility. First things first is a birth control implant. These are 99% effective. They last up to 5 years, and depending on your insurance, they can range from $0 to $1,300. It's basically a single thin rod that is inserted in your upper arm, and it contains progestin that is released for over 3 years. And then there's an IUD. This one's also very common for women. It's 99% effective. It lasts for 3 to 12 years, and depending on your insurance, it can range from $0 to $1,300. It's shaped like a T, and there's the LNG type that is placed in the uterus, and it releases progestin for up to 3 to 8 years. And then there's a copper IUD that's placed in the uterus, and it can last for up to 10 years, and it can be used as emergency contraception as well. But it has to be used within 5 days of the unprotected sex. Then there are birth control shots. Those are 96% effective, and you get them every 3 months, and they range from $0 to $150. And it's basically inserted in your arm or your butt by a doctor. And then there's a birth control vaginal ring. This one's 93% effective. You replace it once a month, and it can range from $0 to $200. Basically, you place it in the vagina, and it releases progestin and estrogen. You wear it for 3 weeks, you take it out during your period, and then you replace it. Then there's the birth control patch. This one is 93% effective. You put it on weekly, and then it ranges from $0 to $150. This one is worn on your lower abdomen, butt, or upper body, but not on your breasts. And it releases progestin and estrogen into your bloodstream. And you also don't wear this on the 4th week so you can have your period. Then there's the birth control pill. This one is also very famous. This one is 93% effective. You take it daily, and it ranges from $0 to $50 depending on your insurance. This contains estrogen and progestin, and you have to take it at the same time every day. And then there's also one with progestin only if you can't take estrogen. And then there's sterilization, but it's basically when you have your fallopian tubes tied so that sperm can't access the eggs that are coming out. This like completely changes the hormones in your body, and so it has a pretty permanent effect on you. And then of course, for both sexes, there's outer course or abstinence, which is basically just keeping your clothes on and doing whatever you're doing with your clothes on. And specifically, it's not having penetrative sex. And this is 100% effective, so if you're interested in 100% effective rating, this is it. All right, we need to talk about the big mama jama, pregnancy. How do people get pregnant? Well, let me tell you. It only takes one sperm cell to get a person pregnant. It takes up to 2 to 3 weeks after sex for pregnancy to happen. Eggs that live in your ovaries and mature during your menstrual cycle, like we talked about before. You have one egg that is released officially. That could be your period, but it hangs out in your fallopian tube to see if any sperm are hanging out, to see if they could get fertilized, because your body wants you pregnant. If semen enters your vagina, sperm can make its way up through the cervix into the fallopian tube and meet that egg. Sperm have about 6 days before they die to find the egg. If they don't, then they die and you're safe. The fertilized egg then moves into your uterus, and it starts collecting more and more cells, and it turns into what's called a blastocyst. This blastocyst hangs out for about 3 to 4 days until it embeds into the uterine lining, and you're officially pregnant. And if you remember, what usually happens with your period is that an egg that's unfertilized will also embed into your uterine lining. And with the period, it realizes it's not fertilized and it sheds that lining. But when you're pregnant, your uterus gets a signal to your brain to release hormones that you are pregnant, do not shed this lining. So because it takes so long to find out whether you're pregnant, you should wait about 3 weeks after sex to test for pregnancy. You can also get a test at a doctor, but avoid any sort of crisis pregnancy centers because they aren't always run by medical professionals and they can tend to scam you. But those medical centers do not include Planned Parenthood. parenthood. And then it's also important to talk about a miscarriage. Many miscarriages, about 15%, happen during the first trimester, and miscarriages are almost never caused by something a pregnant person did. So you can't get a miscarriage from sex or exercising or working. Most injuries also don't cause miscarriages. Most medicines don't cause miscarriages. Things that do cause a miscarriage would be a fertilized egg, taking an abnormal amount of chromosomes, certain illnesses, very serious infection or a major injury, and late miscarriages, which usually occur after 3 months, can happen because of abnormalities in your uterus. So I didn't want to go like month by month with this because there are some really good videos out there and literally just like charts that you can look at that have information on the month by month of being pregnant. So instead I wanted to talk about the realities because pregnancy, ooh, she's expensive and we need to understand how expensive she is. I just mainly want to dissolve also this romanticism around pregnancy. A lot of the time the reality of pregnancy is really rough. So let's look into these costs. I got some charts for you that we're gonna just put on in here. So it also depends on if you have insurance. So if you don't have insurance, you're gonna pay a lot more. So childbirth includes pregnancy, delivery, and postpartum care. And then we have the 2 types of delivery, which is vaginal and cesarean. So you can see that it gets pretty expensive. Childbirth altogether is $18,865. And then depending on the type of delivery you have, a vaginal delivery is about $1,500, and then a cesarean delivery, because it's a surgery, it costs $26,280 on average. If you do have insurance though, it will be significantly less but still expensive, averaging around $2,800 to $3,200. In this childbirth total, you're seeing your OBGYN regularly, you're getting supplements and other sorts of like medications if you're having issues. So there are also hospital charges. You're not only being charged for yourself if you go into the delivery room, but also for your newborn child. And the first year of life ranges from $20,000 to $50,000. That's ridiculous. But after the first year, it does go down to $12,000 or $14,000 a year. Not to mention the, unmentioned prices of maternity clothing, vitamins, comfort bands, pillows, things for the mother who's in discomfort. And then we need to talk about childcare. If you have a job, which it's very expensive to live right now as it is, so you probably have a job. Babysitters are pricey. I remember when I was a kid, I was 12. This shouldn't have been allowed.
That's just like hiring a slightly bigger child. That would be like if you're going out of town for the week and you paid a horse to watch your dog.
I was paid $4 per hour per kid and I watched 2 kids. So I was paid $8 an hour in 2012, no less. Of parents surveyed, 67% are spending 20% or more on annual income for childcare, and 89% are spending 10% or more of their annual income on childcare. You can see it gets pretty pricey. I'm not trying to scare anyone, okay? I'm just trying to be realistic, but these numbers are terrifying. I also think it's important to talk about the emotions that come with having a child, because your hormones in a woman's body, your hormones are going to be changing like crazy. Actually, one of the people that I interviewed, my friend Abby, she had crazy hormone changes, and she even admits she's not going to be like her pre-birth self again for a couple years. There are some really good things that come with pregnancy. I don't think that we should shame people who have unplanned pregnancies. With the church, they tend to address issues a little bit too late and shame people after things have already happened. So instead of shaming, I'm not trying to shame anyone here. I'm just trying to make people aware before something happens that you don't want to have happen. Be aware that there are ways to prevent this. You just have to be responsible. Just like there are ways to prevent STIs and STDs, you just have to be responsible. And it takes $1 to get a condom versus what could be hundreds of thousands of dollars of having a child and taking care of them. So be responsible, everybody. If you like this video, please give it a thumbs up. I know that it was weird to talk about all this stuff, but I also think it's really important, as you've heard me say many times throughout this video. And if you like what you're seeing here, if you like this series, you can always smash that subscribe button. I really appreciate that. And I will see you in the next video when we talk about queer Christianity. controversy.